for joining us for our fifth Fall Prevention Month lunchtime talk. Yesterday we had Sintang Lau speak to us about hearing loss and fall risk. It was interesting. I didn't realize there was a relationship, but apparently those who have a hard time hearing, so for example, if you have a hard time hearing in a crowded environment, like in a cafeteria, you could be at a much higher risk for falls, I think up to 5 times more risk for falls. So very interesting. Today we have Patrick Antonio joining us. He is a PhD candidate with Dr. Stephen Perry, and he does quite a bit of work with people with diabetes and how they ascend and descend stairs with insoles. So today he's going to be talking to us about diabetes. Thank you.
Great. That's okay. Thank you. Thank you for the introduction. Again, my name is Patrick Antonio, and today I'll be talking about diabetes, particularly peripheral neuropathy and the link to falls. You can see me. Okay, great. So just to get started, just a quick definition of diabetes. Diabetes is a chronic disease that affects the body, in which the body's unable to produce insulin or use the insulin it does produce. So insulin is a hormone that when you take in sugar, it converts it into energy. So with a buildup of the sugar in your blood, that it becomes detrimental to your organs, to your blood vessels, and your nerves. So just some quick facts about diabetes. That this is a bit old, but it's 2.3 million Canadians are living with diabetes. Okay, and about 90 to 95% of these individuals will have type 2 diabetes. This is diabetes that you can develop, right, through sedentary lifestyle, high sugary diets, poor diets. And lastly, the Canadian Diabetes Association in 2014, they came up with a number that said 5.4 million Canadians have what's termed as pre-diabetes, or blood glucose levels higher than normal individuals, but not yet high enough to be diagnosed as type 2 diabetes. So if you think about it, with current lifestyle, trends and with sedentary lifestyles and high sugary diets, that number 2.3 million can increase. So with diabetes, there are many complications that can arise from diabetes, such as kidney disease, eye damage, nerve damage, heart disease and stroke, depression, anxiety, and eating disorders. But for the purpose of this talk today, I want to look at neuropathy, nerve damage. And as I mentioned earlier, with the high blood glucose levels, they can eat away at the organs, blood vessels, and nerves. And for neuropathy or nerve damage, you see here a comparison between a healthy blood vessels and nerves and an individual with diabetic peripheral neuropathy who has damaged blood vessels and nerves. So the takeaway message from this is that because the blood is is getting clogged due to the sugars, there's less blood oxygen going to these nerves, and these nerves are dying. So what's happening then is the nerves, in particular the nerves in your peripheral limbs, so your hands and your feet, they are displaying symptoms of pain, tingling, and numbness because of the lack of that nerve oxygen. So with that as well, a study by Bolton in 2005 looked at and said that 50% of individuals with diabetes have detectable peripheral neuropathy. So if you think about the number 2.3 million, half of those individuals will have at some point detectable peripheral neuropathy. So that can vary, meaning like some people will have worse off loss of sensation in their hands and their feet, while some will have not so much, it won't be so bad for them. So the issues with diabetic peripheral neuropathy in particular is that there's a lack of foot sensation, and this lack of foot sensation can compromise your balance. So if you think about it, if you don't have a lot of that feedback in your feet and you're walking around, then that can be problematic for your balance, and you could fall. That's a big issue. But also, the second part is that diabetic peripheral neuropathy has been directly linked with the formation of foot ulcerations. So foot ulcerations are just foot cuts on the bottoms of your feet, as you see here. And what's happening is there's high pressures occurring every time you walk. There's particular spots in your feet that that really take up most of your body weight. So the big toes, the balls of your feet, and the heel. So these pressure spots, especially with continuous repetition, they'll start to tear away at those tissues in your feet and can cause ulcers. And with numbness and tingling in your feet because of diabetes, you're not really getting that same response to tell you it's painful, don't put your feet down. So with that, the ulcerations can then lead to infections if they don't get treated. And if it does, and if that continues on, then amputations can occur. So in starting kind of my research into this, I was talking to an individual whose family member had problems with their feet. It was an older individual, older family member, and the family member was complaining of discomfort in the feet, numbness, and kind of the feet was falling asleep near the end of the night. And so they were advised to go to the doctors, and they did. And afterwards, the doctor diagnosed them with diabetes, in particular peripheral neuropathy, because of the loss of sensation. So soon after, I think maybe 2 to 3 weeks later, this individual told me that their parent ended up having to get their foot amputated or the foot partially amputated because they didn't look into they didn't know that this was a problem for diabetic individuals. And in particular, like the infection got so bad that it went right to the bone. So just to show you that diabetic peripheral neuropathy is can be very aggressive if it's not treated, if it's not dealt with. So just this brings up to kind of why I'm talking today. How do people fall if they have diabetes? So in particular, diabetic peripheral neuropathy, with the loss of feeling in the feet, simply they have bad balance. And with that, it can lead to them falling. But the other more alarming one to me is the fact that there are management tools to prevent individuals from getting, or if you already have foot ulcers, it kind of helps. Did I press something? Anyway, so with individuals with foot ulcers, the best way to actually treat ulcers is to wear these casts, these total contact casts or removable walkers. So what they do is they completely disperse or offload that pressure in your feet. So you're not actually getting that pressure anymore in that big toe or on the balls of your feet. It actually moves it away. So it's a good way of actually preventing or limiting further ulcerations. But who's ever worn kind of these devices? They're big and bulky, and they're awkward to walk with. So if you're walking around, you have to get trained. You have to get used to these devices. So already your mobility is compromised. It's you have to train how to do this. So, and especially with stairs, if anyone can attest to this, if they've worn this going up and down stairs, it's very problematic because you can definitely lose your balance because there's not a lot of range of motion in your feet when you're walking up and down the stairs, and you need that. So what's happened then is people will fall from this. There's a potential for that. So my ongoing research now is to address the importance of foot pressure offloading to prevent ulcer formation, but at the same time, looking at the importance of balance feedback to the feet to prevent people from falling. So essentially trying to look at other devices instead of these contact casts or these removable walkers. Sorry if you can hear me. These removable walkers. So we're looking at new designs and trying to come up with a better combined result, I guess. So with my research, I want to investigate stair gait, foot pressures, and balance of individuals with diabetic peripheral neuropathy. We also want to assess the pressure and balance effects of various consumer preferred diabetic footwear devices. So that is kind of what you already see in the market today as what people say are diabetic insoles. Or if you go to Shoppers and they say diabetic insoles, do they actually work? So what we're trying to do is to see if these will actually offload what they say they offload. And lastly, to develop guidelines and or assistive devices to optimize ulceration prevention and maintain proper balance if kind of these fall, what we see in the market aren't adequate enough. So with my research, we'll be using if you're going down with the tour later, you'll be seeing this motion base downstairs, and I have the Stair lab down there, and I'll be running participants up and down stairs. And again, the reason we use stairs for this study is so that we can, because stairs is a very common task in itself. Everyone's walking up and down stairs, but with stairs, it comes with higher pressures when you're walking up and down, especially in the balls of your feet, as opposed to level walking. So, so with that, that's already an issue that we want to address and look into. And with this, we have participants. We'll have participants with diabetes, particularly peripheral neuropathy, and an age-matched control group, where the age-matched control group will be placed in the moving room, and that will simulate the fall. So we'll essentially put them in a position where they'll fall, but they'll be harnessed in, so they'll be pretty safe. So the significance of my research is to better understand the individual's behavior of falling, to understand how foot pressures behave, especially during a perturbation or a movement of the room, and then to understand how balance is altered when that room is moved. But also, we want to look at the individuals with diabetes, and we want to improve on the current insole design to prevent ulcers, and then to improve balance, and essentially to prevent falls. So in the meantime, as we start to collect this data and start to formulate the, kind of our results, just to give you some helpful tips while you're waiting for my results, essentially. So if you have, for falls prevention for individuals with diabetic peripheral neuropathy, so if you have peripheral neuropathy, or you're questioning whether or not you may be at risk for having it, the first thing you really need to do is educate yourself. Go to a doctor and look at and see if you are at risk, or with the symptoms that I talked about earlier, to see if you're at risk. See if you have peripheral neuropathy. They can test for that. Who should I consult? Your doctors. And what they'll most likely do is, if they don't have a handle on it, they can send you or refer you to a foot specialist, or a podorthist, chiropodist, individuals who are specialized in the feet. But then, what if I have a lesion? What if you already have diabetic peripheral neuropathy, and you have a lesion? What do you do? First off, again, go to your doctor. That's primarily what you do. But also educate yourself as to knowing that you have foot lesions, knowing that foot lesions can and are very prominent for individuals with diabetic peripheral neuropathy. So a review study in 2000 that showed that only 56% of foot lesions were detected, meaning almost half of individuals with lesions didn't know they had lesions. So it's all about educating yourself and knowing what to do if you have diabetes or ulcerations. And that takes me to the next point of foot care. So regular foot inspections. So if you do have peripheral neuropathy, but you don't have ulcerations, it's a good thing to regularly inspect your feet, especially if you have numbness, because you're not really looking at your feet too much. But it's very important to start doing that if you haven't. If you do have, again, peripheral neuropathy, make sure you have access to foot care specialists. Again, the chiropodists, the doctors, the podorthics. And then lastly, to acquire adequate footwear, shoes that aren't too small for you or too big for you. So proper fit, proper densities and insoles, and protective and therapeutic shoes. So to kind of finish off, because I do talk about the insoles part and looking at and making sure that you have proper insoles. My research is still looking into the fact that which insoles is the good which insoles are good, and what things can be improved on with insoles. So I'll be conducting my research study soon, within the next few months. So if you are interested in taking part in my study or learning more information about my study, you can contact me. Again, my name is Patrick Antonio, or email my supervisor, Stephen Perry, at this address. Thank you very much.
Thank you, Patrick. I was wondering if anyone has questions for Patrick over here.
About type 2 diabetes. Is it type 1, or does it mean that it's just beginning to happen?
Type 1 is okay. So the question was about type 2 diabetes, but what about type 1 diabetes? So type 1 diabetes does, people will still get peripheral neuropathy with type 1 diabetes. That is correct. But I just wanted to stress that type 2 diabetes is something that we can prevent, because with our lifestyle, like we can develop type 2. Yes, exactly. So all the symptoms and kind of the resulting complications are exactly the same, but it's just that if you don't have diabetes, then you can develop type 2 diabetes and have these issues. So kind of more preventative, but yes, good point in bringing up that type 1 and type 2 will equally get the same issues.
So I know, so Stephen Perry is going to be talking about these insoles, Balance Pro, on the 19th. I just checked the schedule. And I wonder if you could comment on these things. So my understanding is these are designed for people with peripheral neuropathy, and the way they're very simple product where they have a ridge that runs along the outside edge to provide a bit more stimulation for nerves that are still intact under the skin. But I understand these are not recommended for people with diabetes because of risk of causing ulceration.
Yeah, that's an interesting point, because at some point, so as Tilak was saying, these has the ridges on the edge. That's an interesting point, because that's kind of another path of what we wanted to take this research, is to test that, because we didn't really know yet. Is this going to be too detrimental for the individual because these risks will add that pressure, or or will it be sufficient enough? So the second part of the research is to look at developing other ways to provide that increased feedback. So one way could be this, or another, or we're looking at the other measures as well. But that's definitely something that we thought of, and hopefully we'll get back to you with the answer soon.
Thank you very much, Patrick. I really appreciated that talk, especially the practical tips you provided. So yeah, if you're interested to learn more about the Balance Pro and insoles in general that can help prevent falls, please come back on the 19th. Dr. Stephen Perry will be talking about that. Tomorrow there's no talk. It's Saturday, but Monday you can come back. There'll be another talk. Right after this, we have a tour scheduled of our research facilities. So you probably noticed the stairs that Patrick is doing his research on. He'll be seeing that lab with the stairs, as well as many other very neat labs. So thank you very much, and I'll see you on Monday.